Yes, my name is Art Martinez. I'm the Surgical Technology Program Director for SJVC in Temecula. I've been in the business for 34 years now. I graduated back in 1986. I was part of the ongoing or outgoing Baylor program in Houston, Texas. We usually get in there by between 6 and 6:30 to get ready, to get prepared, to get properly dressed, to make sure that we go over the case. That's our first case of the day, to ensure that we have all the instrumentation necessary, all the supplies that are going to be needed for that surgery. During the surgery, we pass instrumentation. We become the right hand and the left hand of the surgeon. We make sure that we rinse all the instruments, put them in to soak, to make sure that there's no blood clotting on the instruments, so that it becomes easier for central service to process the instruments, to clean them, to wash them, and to re-sterilize them. And then we get ready for the next case. Because the technology is advancing. Before, we didn't have as much technology as we do now. Now we're going into robotic surgery. There's technologists that specialize in robotic surgery, and that's all they do, which is minimally invasive surgery. Surgery is leaning more towards becoming minimally invasive. In other words, we don't open the patient as much anymore, and that's due to the doctors and surgeons in hospitals not wanting for surgeons to acquire nosocomial infections, meaning they don't want an infection that's acquired at the hospital, and that usually happens when we have to do an open procedure on a patient. And open procedures require more length of stay in the hospital versus minimally invasive procedures, which usually they're 23-hour procedures. In other words, 23-hour stays. You get to do the surgery within 23 hours. You get to go home. So there's a lot of surgery that's leading towards laparoscopic surgery, which means minimally invasive. In the field of surgical technology, you need to be able to be a quick thinker on your feet. That's, be able to multitask, because you might be doing a total hip procedure and all of a sudden your patient starts having difficulty or starts crashing on you, and you might have to go from an open hip procedure to an open heart procedure within 4 to 5 minutes. SJVC has the same curriculum that every other program has in the United States. We teach the 6 core curriculum that's prescribed by the Association of Surgical Technologists. They're taught anatomy, physiology, pharmacology, which are the drugs that are used during the surgical procedure. They learn about anesthesia, how a patient is put to sleep, and what medications are used. They learn about microbiology, infections. Infections to the surgical technology and the doctor are very important, but also to the patient. They learn about, again, sterility. They learn about contamination. They learn about surgical procedures. They basically have to know where the surgeon's at all times in their surgical procedure. It's been commented to me by several of the doctors that I have had communication with regarding our students. It says, we have to admire you and your instructors and what you do with the students, because you try to basically make an MD out of the student. That we're a family. At SJVC, we're all together. We're always looking out for the students' best interest. We all work in collaboration. It's not this program versus that program. It's all the programs together. The students they're all our students, whether it be a DA student, electrical student, HVAC, respiratory. We're all in it together, and the camaraderie and the family effect that SJVC has.